Welcome back to our Technology Track series. The module we'll discuss today is return on investment in regards to intraoral cameras. We'll take a look at intraoral cameras both from a risk side and a benefit side, and take a look at each of the three categories on either side to see if this piece of technology is something that would fit for you in your office once you get out of school. So, first of all, risks. What do intraoral cameras cost? On average, somewhere between $7,500 and $10,000, depending on the quality of the camera and the ease of use of the camera. Now, the good thing, as far as risk and money goes, is once you've made that purchase of an intraoral camera, they're pretty indestructible. So, unlike some of the other pieces of technology, your big cost is up front, but there really isn't a lot of maintenance or upkeep that you have to worry about. Risk number two, learning curve. Not so bad today. The old systems with intraoral cameras used to be pretty elaborate. They were standalone systems. You had a tough time taking images and then filtering it into whatever software program that you had. Today's are very, very simple to use, pretty much aim and shoot. Today's are pretty easy to take multiple types of images, and today's are very plug and play. So ease of use, the learning curve is pretty straightforward. As far as integration goes, again, it's easy to use and implement from that standpoint. The challenge with integration comes with making sure that your team utilizes the technology. Because with this particular piece of technology, you as the dentist may be taking some pictures. Say, for example, you have a patient in and you're going to be replacing an old amalgam filling, or maybe they have a defective crown, or you want to teach them something on a restorative side. You may be the person who's taking the pictures. But oftentimes in a private practice setting, it's going to be a dental assistant or a dental hygienist who will take these pictures. So the key to integration is making sure that everyone on your team feels very comfortable with the technology, and that you as the leader expect them to use it and hold them accountable if they don't use it. It's really about leadership. On the benefit side for intraoral cameras, what do we consider when we're looking at finances? I guess the simplest way to put it is a picture's worth 1,000 words. And oftentimes in dentistry, there's a question mark in a patient's mind, do I really need this treatment? So you and I can have great discussions with patients all day long until we're blue in the face. But it's really simple to take a picture of a tooth that has a fracture in it. It's really simple to take a picture of an old amalgam that's broken down. Patients understand those images. So on the benefit side, from a finance perspective, as soon as you take an image and put it up on a screen, magnified 20 to 30 times, your patient understands. So co-diagnosis and treatment planning and patient acceptance goes through the roof with this piece of technology. Better treatment, I would say better treatment comes from what we just mentioned. Because your patients have a better understanding of their needs, they tend to say yes to the treatment that you prescribe, as opposed to either delaying the treatment or trying to find ways to do a four-surface filling instead of a crown. They have a better comprehension of what you and I see, and as a result, they say yes to better treatment. The last piece on the benefit side, marketing. Again, as a piece of technology, perception is reality. So patients are looking at any piece of technology, especially one that allows them to see what's in their mouth, as a huge benefit to them and something they talk about. Now, one thing you can do from a marketing standpoint that works really, really well is, in addition to taking these images and showing them to your patient on a screen, is you can print them. So many times in our practice, if we have a patient who needs to contemplate the treatment that we've suggested, as a marketing tool, we will physically print those photos out. They can take them home, and what are they going to do when they get home? They're going to show them to their spouse. They're going to figure out together how to make it happen, and eventually they'll have a conversation with other people about this technology in your office. It's a great way to separate yourself from other practices in the neighborhood, and it's a huge adjunct to you as far as getting patients to understand their treatment, which will in the end allow for better treatment and on a financial side, more treatment.